صباح الخير طلبتنا الأعزاء. Our lecture today will be about the pituitary hormones. The objective of this lecture is to list the hormones that are synthesized and secreted by the pituitary gland and the biochemical role of each individual hormone. The second objective is to describe the control over each individual hormone, whether it is inhibitory or stimulatory control. And the third objective is to state how can we assess biochemically the hormone when we suspect that a person has an excess or deficiency state. Before we start in the details, we will remind you of some of the endocrine principles. First of all, the definition of the hormone. It is any substance that are secreted by an endocrine gland and then it will be transported in the blood to regulate the function of another tissue or another gland. Some of the hormone can influence the tissue directly. Example, growth hormone, it will affect the bone and the other tissue. Another example is the prolactin hormone that act on the mammary gland or mammary tissue, while other hormones that are called the trophic hormone, they stimulate other endocrine gland to secrete hormone. So the trophic hormone, the product of the trophic that perform its action on another target endocrine gland to secrete other hormone. The product of the target endocrine gland, not the trophic, the target endocrine gland, partly can control the release of the trophic hormone by a negative feedback inhibition. We will take example in the subsequent slide. For example, the pituitary gland can secrete a hormone called the thyroid stimulating hormone, and it controls the activity of the thyroid gland. It allow and control the synthesis and secretion of thyroid hormone from the thyroid gland. So the thyroid stimulating hormone is considered as an trophic hormone. The target is the thyroid gland and the production of the thyroid hormone. The thyroid hormone can control the secretion of the thyroid stimulating hormone by negative feedback inhibition. Another principle is that some disease may result from secretion of excess or deficit amount of certain hormones. The secretion of hormone may vary and it is not fixed all over the 24 hour, and this is called circadian, or sometimes not even within the same day, sometimes may take longer period. For example, the hormone of the menstrual cycle change in a monthly pattern. Another principle is that the secretion either occur in an episodic pattern. Every period of a specified period of time there will be secretion of a hormone, or it responds in response to certain stimuli such as stress. For example, the glucocorticoid, for example the cortisol, is secreted in response to stress. Certain hormones as insulin are secreted in response to change in the blood glucose level. Another principle is that abnormality of the target gland, either it is primary to the gland itself or it's secondary to defect in the controlling mechanism. We will return to the same example. For example, the thyroid gland secrete the thyroid hormone. If we have abnormality in the level of the thyroid hormone, either the defect is in the thyroid gland itself, so that it cannot synthesize, maybe destroyed, maybe there is it cannot synthesize because of deficiency of iodine, cannot synthesize adequate amount of thyroid hormone. Or it may be secondary to defect in the pituitary gland that secretes the thyroid stimulating hormone, so that the defect in the thyroid gland may be secondary to the defect in the pituitary gland that secrete the thyroid stimulating hormone. The anterior pituitary hormone. As we know, the pituitary gland composed of two lobes, the anterior pituitary, or it's called the adrenal hypophysis, and the posterior pituitary lobe, that's called also the neurohypophysis. They are different. The anterior is glandular mainly, while the posterior is neural in origin. And the hormone that are secreted from the anterior pituitary mainly is regulated by the hormone secreted from the hypothalamus. And both the hormone that are secreted from the anterior pituitary and the hypothalamus are subjected to the feedback control from the hormone whose production they control in certain organ. For example, أيضا نرجع لمثالنا اللي هو الثايرويد هرمون control the activity the secretion of the thyroid stimulating hormone from the pituitary. Also, we have another hormone higher center from the hypothalamus. We have the thyroid releasing hormone that control the activity of the thyroid, the pituitary to secrete thyroid stimulating hormone. Thyroid stimulating hormone from the pituitary stimulate the thyroid gland to secrete thyroid hormone. The thyroid hormone from the thyroid gland can control by negative feedback the amount and the secretion of the thyroid releasing hormone from the hypothalamus and the thyroid stimulating hormone from the pituitary gland. The anterior pituitary hormones are either a glycoprotein or they are proteins in nature. These are the list of the hormone that are secreted from the anterior pituitary hormone. We have the gonadotropins, which include the follicle stimulating hormone. From its name, it's obviously stimulate the follicle growth in the female. In the male, it will stimulate spermatogenesis. The other one is the other gonadotropin is the luteinizing hormone. It enhances the ovulation and maturation of the ova in the female. In addition, it can maintain the corpus luteum. While in the male, the luteinizing hormone, the LH, stimulates testosterone production. Other anterior pituitary hormone is the prolactin. It stimulates the lactation. ACTH, the adrenal corticotrophic hormone, stimulates the adrenal cortex to produce the glucocorticoid. The most important is the cortisol. The thyroid stimulating hormone also is one of the anterior pituitary hormone, stimulate the thyroxine release from the thyroid gland. We have also the growth hormone. It is important for the growth. From the posterior pituitary part of the pituitary gland, we have certain hormones that are released from it. It's not synthesized there. It is synthesized in the hypothalamus, but it is released from the posterior pituitary. We have the vasopressin, also it is called antidiuretic hormone, and we have the oxytocin. These are schematic representation. We will see that the hypothalamus secrete the growth hormone releasing hormone that act on the anterior pituitary gland, stimulate the release of growth hormone, and the thyroid releasing hormone from the hypothalamus stimulate the release of thyroid stimulating hormone from the anterior pituitary gland, this hormone will act on the thyroid gland, stimulate the release of thyroid hormone, the thyroxine, the T4, and triiodothyronine. We have also the corticotropin releasing hormone from the hypothalamus, which will act on the anterior pituitary, stimulate the release of adrenocorticotrophic hormone, the ACTH, from the anterior pituitary, which act on the adrenal cortex and stimulate the release of the glucocorticoid. The most important one is the cortisol. Another hypothalamic hormone is the gonadotropin releasing hormone, which acts on the anterior pituitary gland and stimulate the release of follicle stimulating hormone and luteinizing hormone. Both act on the gonad. From the posterior pituitary, we have the antidiuretic hormone, which act on the kidney and stimulate the water reabsorption, and the oxytocin act on the uterine smooth muscle and on the mammary gland. The first hormone that we will discuss is the growth hormone. It's also called somatotropin. It is a polypeptide hormone. From its name, it's obvious that it is essential for normal growth. The mediator to its action is a protein that is synthesized by the liver, and it is called insulin-like growth factor 1. The growth hormone have a number of metabolic effects. It has a ketogenic effect by increasing the lipolysis. It has a diabetogenic effect by increase the hepatic glucose production, and it will decrease the tissue glucose uptake. Both of these actions may increase the blood glucose level. Growth hormone also have an anabolic effect. It acts by increase the protein synthesis. The control over the level of growth hormone is by two hypothalamic factors, which is the growth hormone releasing hormone from the hypothalamus and the somatostatin, which has an inhibitory effect. Somatostatin is not only found in the hypothalamus, it's found in many tissues in the body. The insulin-like growth factor 1, which is the mediator of the action of growth hormone, have a negative feedback and modulate the effect of growth hormone releasing hormone, and together with growth hormone will stimulate the release of somatostatin. The secretion of growth hormone is not fixed all over the day. It's occur in sporadic bursts, and each of these lasts for 1 to 2 hours. Sometimes even in normal healthy individual, we may find the level of growth hormone is undetectable. That doesn't mean that we have deficiency, because the secretion of growth hormone is not fixed all over the day. The secretion mainly occur during deep sleep. During the whole life, the secretion of growth hormone also vary. Mainly it increases from birth to early childhood, and then during later after the early childhood it will remain stable. At puberty it will have a massive increase again by the effect of the gonadal hormone, and then during adulthood it will remain stable, and in old age start to decrease again. What will stimulate the secretion of growth hormone? We have many factors that stimulate the secretion of growth hormone. For example, the stress may increase the secretion of growth hormone. Hypoglycemia and fasting will stimulate growth hormone secretion. After exercise, also growth hormone will increase. Certain amino acids have a growth hormone enhancing effect. And on the other hand, what are the factors that decrease the secretion of growth hormone? The most important one is the increase in blood glucose. So hyperglycemia will inhibit the secretion of growth hormone, while hypoglycemia stimulate the secretion of growth hormone. شو نقدر نستفاد من these inhibitory and stimulatory effect؟ ممكن نستخدم هذه إذا أنا كنت أتوقع إنه this patient I suspect that he have growth hormone deficiency، ممكن child and he have growth retardation or مثلا يكون عنده short stature، فممكن أستخدم any of these factor as stimulatory factor وأقيس الجروث هرمون at time 0 وأفتر إنه بعد ما أسوي له stimulation مثلا by stress، ممكن induce stress وبعدين راح نيجي ناخذ شلون we induce stress or by exercise or hypoglycemia، وممكن وراها أقيس ال level of growth hormone in response to this stimulation. المفروض in healthy individual after this stimulation growth hormone level مالته يرتفع. Failure to achieve this response معناته it confirms some sort of deficiency of growth hormone. والعكس صحيح. If I expect someone have growth hormone excess and I want to see whether it is normal or it is autonomous secretion, uncontrolled secretion of growth hormone، ممكن بهالحالة I give something that normally inhibits growth hormone secretion اللي هو the well known factor هو the hyperglycemia. فممكن I will induce hyperglycemia، أشوف ال effect of hyperglycemia on the level of growth hormone، ممكن أقيسه بالتايم 0 وبعدين بعدها I induce hyperglycemia وأقيس الجروث هرمون again. المتوقع المفروض بالhealthy individual growth هرمون راح يقل after hyperglycemia، إذا ما قل معناته I have autonomous uncontrolled secretion of growth hormone. Acromegaly and gigantism are diseases that are caused by increase in the level of growth hormone, while if I have low level of growth hormone in children this will be presented as short stature and growth retardation. In adult راح نشوف إنه الgrowth hormone راح patient دائما in adult if you have deficiency of growth hormone you will have fatigue, the muscle strength will be lost, and the psychological well-being also will be impaired. The total cholesterol will be high, the low density lipoprotein, low density cholesterol will be high, which is the bad cholesterol, and the fibrinogen level also will be high. All these have an adverse or bad cardiovascular risk profile. Somatostatin is a hypothalamic peptide. It inhibits the growth hormone secretion, and as we said, it is not found only in the hypothalamus, can be found in other tissue, especially in the GIT. Ghrelin is another peptide that affects the secretion of growth hormone. It have a stimulatory effect on growth hormone secretion. The main function of ghrelin is in the regulation of the appetite. The other pituitary hormone is the prolactin. It's also a polypeptide hormone found in many forms. Either it is monomeric or polymeric form. With polyformic we have different different polymeric forms. The main effect of prolactin is to initiate and sustain lactation. Secretion, main control of secretion is by the hypothalamus، لكن the control is inhibitory rather than stimulatory. Control هو inhibitory by the effect of dopamine. Dopamine inhibit or decrease the release of prolactin from the pituitary gland. فإذا عندنا any defect in the hypothalamus that inhibit the release of dopamine or in the pituitary portal so that the dopamine cannot reach the pituitary gland، راح يكون inhibitory effect will be lost. فبهالحالة البرولactin راح يكون عالي. Why? Because the control is inhibitory. فإذا فقدت inhibitory control معناته البرولactin secretion will be uncontrolled، راح يكون high. mainly prolactin إنه يزيد in time of pregnancy and suckling. وأيضا البرولactin secretion is pulsatile يعني ما يكون fixed all over the day. When does prolactin increase? In a certain condition that increase the prolactin level during sleep البرولactin يزيد. After meal أيضا prolactin increase. Exercise أيضا prolactin and it will increase it. And the stress, when we talk about the stress ممكن يكون هذا physiological stress, ممكن يكون psychological stress. Any stress may increase the prolactin level. Even the exercise ممكن إنه before you interpret the result of prolactin in the blood you must make sure that the patient was not subjected to stress. even مرات أحيانا حتى stress of drawing blood ممكن يسوي له stress. ممكن exercise even مثلا يصعد درج ممكن هذا it will cause some stimulation to the secretion of prolactin. So we must keep the level of exercise and stress to minimum before collecting blood sample for measuring of the prolactin and before interpreting the high level of prolactin in certain patient. طبعا prolactin هو أيضا depend on the estrogen state ولهذا during the menstrual cycle من احنا نريد we interpret the level of prolactin لازم انه احنا بكل phase of the cycle يختلف interpretation والnormal level مالته عن ال other phase of the cycle. بالfollicular phase يختلف عن luteal phase. What is macroprolactin? Is a complex between prolactin and the IgG antibody. هل إنه biologically it is active? No, it is not active. بس أحيانا من نقيس level in the blood راح نشوف إنه hyperprolactinemia. ممكن تكون هذه الهايبربرولactinemia before we start treatment we must check whether this is a true hyperprolactinemia or it is a macroprolactin اللي هو ناتج عن bounding between the IgG antibody and the prolactin. فنستخدم certain before if the patient presented for the first time with hyperprolactinemia we must make sure that this is not a macroprolactin molecule. بهالحالة we instruct the lab to do certain method by precipitation to remove the macroprolactin ونرجع نقيس مرة ثانية the level of the prolactin in the blood. أهميته إنه أحيانا يسوينا misinterpretation of the result of high prolactin level. Thyroid stimulating hormone. This hormone from its name it stimulates the production of thyroid hormone. It is a glycoprotein and it composed of two subunits which is the alpha and beta subunit. The alpha subunit راح يكون similar للامينو acid sequence in the alpha subunit راح يكون similar in the TSH thyroid stimulating hormone, in the gonadotropin the FSH-LH and in the human chorionic gonadotropin اللي مختصرة هو HCG. اللي يختلف بين ذول الفور هرمون is the beta subunit. The amino acid sequence in the beta subunit هو راح يعطينا uniqueness to each of these four hormone. What stimulates the production of thyroid stimulating hormone is the thyroid releasing hormone from the hypothalamus. It will stimulate the production of the thyroid stimulating hormone. After release from the pituitary, it will bind to a certain receptor on the thyroid cell and stimulate the synthesis and the release of the thyroid hormone. After the thyroid hormone are released from the thyroid gland, it will exert a negative feedback control on the secretion of the TSH and thyroid releasing hormone. Sometimes there is a delay in the TSH response to change in the thyroid hormone concentration. فأحيانا it will take 12 weeks. فممكن أحيانا إذا patient عنده hypothyroidism and we give him a treatment راح نشوف إنه الثايرويد هرمون level راح تكون normal but TSH is still maybe high or in the response is not fully achieved because this is because of its nature. It will take about 12 weeks to fully return to its normal level. The other pituitary hormone are the gonadotropin. We have two types, the follicle stimulating hormone and the luteinizing hormone. And as we say, the alpha subunit, the amino acid sequence in it هو similar بالفور هرمون بالFSH, LH, TSH, بالHC, بالhuman chorionic gonadotropin, but the uniqueness is by the amino acid sequence that found in the beta subunit. The gonadotropin from the pituitary gland are controlled by a higher center from the hypothalamus. We have the releasing factor called gonadotropin releasing hormone, and the effect are also regulating by negative feedback from the hormone that are released from the gonad اللي هو الاستروجين and the progesterone, the testosterone, the inhibin, all affect the concentration and of the gonadotropin releasing hormone and the gonadotropin. طبعا secretion also occur episodically. ما راح يكون fixed all over the month، ما راح يكون fixed all over the day, and it is pulsatile. وطبعا secretion of the FSH وال LH والlevel مالتهم هو not parallel، ما يكون دائما نفس فأحيانا certain time of the or phases of the cycle the FSH is increased and the LH is low and vice versa، فيختلفون حسب الphase of the cycle بالفيميل وكذلك بالميل according to the level of the gonadal hormone. The main function of LH is the hormone production. In the male it stimulates testosterone production, and in the female it will stimulate the estrogen and progesterone. The testosterone in the male هو المسؤول عن الفيدباك inhibition on the gonadotropin releasing hormone، فيقلل LH production، بينما ال FSH not for hormone production mainly هو for spermatogenesis، والinhibitor هو الانهبين اللي هو will exert a negative feedback control. Adrenal corticotrophic hormone is another hormone. It is abbreviated as the ACTH. It is a polypeptide hormone. Stimulate the adrenal cortex to secrete a category of hormone that are called glucocorticoid. For example, the cortisol, the cortisone, and other. The most important of these glucocorticoid is the cortisol. What stimulates the ACTH production and synthesis and release is the hypothalamic corticotropin releasing hormone, and the level of the cortisol that are secreted from the adrenal cortex will exert a negative feedback on this axis, hypothalamic pituitary adrenal cortical axis. اللي يميز ال ACTH انه it have a diurnal variation، راح يكون انه عالي in the morning and lowest at the midnight. ممكن استفاد من هذه الخاصية في انه اني اعرف الماكسيمم برودكشن هو at 8 AM، فلازم اقيسه around this time. اذا شفته بالتايم of maximum production maximum level يكون قليل، so this will وممكن يكون بالليل يكون at the من أنا أتوقع مثلا المفروض يكون lowest at midnight. لما يكون at midnight هو يكون عالي، معناته هذا diurnal variation is lost، وهذا indicative of a disease state. One of the main control or factor that increase the ACTH secretion is the stress. فأيضا من أريد أقيسه لازم أحاول أخلي the level of stress to minimum. The ACTH هو part of a larger precursor molecule is called pro-opiomelanocortin. Pro-opiomelanocortin will be divided to give up ACTH and beta-lipoprotein. Later there will be more division. It will give us endorphins اللي هو endogenous opiate and the melanocyte stimulating hormone اللي هو responsible for the production of the melanin by the melanocyte. ولهذا أحيانا نشوف إنه بعض الديزيز that are associated with abnormal level of the ACTH يكون عندها change بالcoloration of the skin و hyperpigmentation because الزيادة أيضا راح تسوي لي زيادة ال ACTH and the pro-opiomelanocortin يسوي لي eventually زيادة بالmelanocyte stimulating hormone and more production of melanin, and later there will be a hyperpigmentation. If we suspect a patient have an abnormal level of certain hormones, سواء كان hypofunction يعني low level of the hormone or hyperfunction, the best way to investigate the anterior pituitary hormone is to measure both the hormone that from the pituitary gland itself and the target organ hormone, مثلا TSH, thyroid stimulating hormone, and the thyroid hormone. والmeasurement must be at the same time، يعني مو أقيس TSH at a sample blood sample مثلا بالمورنينج another hormone مع target organ I will measure it at the night. لا، المفروض تكون at the same time at the same sample because it will be more informative. If I measure the level of the hormone from the pituitary gland and the target and the result of both of them were abnormal, this is very clear and diagnosis will be obvious. But if the result of these tests are equivocal or not very conclusive, in this case نحتاج نسوي the dynamic test. The dynamic test we will measure the response of the gland after we do stimulation or suppression by certain stimuli that we know that it affect their secretion. يعني إنه إذا كان الريزلت قست الهرمون level of the pituitary gland وتارجت مثلا ACTH والكورتيزول وكانوا abnormal فالdiagnosis will be obvious and clear. بس إذا كان equivocal not very clear إنه عندي abnormality or not والclinical feature is highly suggestive of abnormality وأريد أتأكد by chemical measurement، بهالحالة استخدم stimulation or suppression test. أنا أعرف مثلا هذا الهرمون مثلا affected by stress، I try to induce stress and measure the hormone level وأشوف الريسبونس مالته. فعندنا we have two type of dynamic test حسب الكونديشن. إذا كان عندي I suspect low level or suspect excess state فممكن استخدم either suppression test or stimulation test. When do I use the suppression test? It is used when I suspect that I have excess hormone secretion. Any substance I know that it's normally suppressed secretion by the negative feedback, I give this substance and measure the response of the gland to this substance. If it's failed to suppress, then in this condition it means that the normal feedback control not working in a proper way, with secretion is autonomous يعني uncontrolled secretion. For example مثلا I know that the growth hormone is suppressed by hyperglycemia. ممكن I will induce hyperglycemia and I measure the level of the growth hormone. أتوقع مفروض normally it will decrease. Failure to suppressed, it means that it is not under negative feedback control. The stimulation test إيش وقت استخدمها؟ بالعكس لمن I have low level of the hormone, I suspect that I have low level of the hormone, then the trophic hormone that or any substance that stimulate the secretion, I give it to this patient ونشوف the response of the endocrine gland whether it responds to the stress by increasing the level of the hormone that I suspect it is of low level. يعني أعرف شنو الstimulus that make this hormone is released. I induce some state بحيث إنه أسوي له stimulation by this substance. إذا ما صار عندي response after stimulation معناته I have a problem in this gland. This is an example of a stimulation test, the insulin hypoglycemic test. we can measure the response of certain hormone like growth hormone and the ACTH to stress. The hypoglycemia is a stress state, and this test is hazardous and dangerous and must be performed under a clinical supervision and in certain center, because sometimes the hypoglycemia may cause severe adverse effect. So the principle of this test إنه I take blood sample and I measure the hormone that I suspect they are in low level. For example, in this case the growth hormone and the ACTH. I know that stress and hypoglycemia induce the synthesis and secretion of these hormone. فبالبداية at time 0 بدون ما أعطي كل شيء راح أقيس the level of this hormone in the blood. Then after that I give him a calculated dose of insulin according to his body weight, وأتأكد إنه صار عنده hypoglycemia after a defined period of time تكون محددة حسب بروتوكول محدد. أرجع مرة ثانية أقيس level of the growth hormone and ACTH. المفروض الانسولين induced hypoglycemia تزيد level of growth hormone and ACTH. If it doesn't increase after this test, it means that I have a defect in the level of this hormone, and I will search for the site of the defect. If I suspect that I have a growth hormone deficiency, in this condition, many tests can be performed. The first one, which is the screening, is the blood growth hormone level. Although it is not very helpful because the growth hormone secretion, as we said, it is sporadic. ممكن يكون even in healthy individual at certain time تكون undetectable. فإذا شفت I have a low concentration of growth hormone in this patient, it cannot confirm that this patient have a deficit state. ممكن انه اسوي له serial measurement of growth hormone، اقيس ال level of growth hormone over 24 hour، وهذا يكون is more informative. I can also use the insulin induced hypoglycemia by using the test that we in the previous slide. We induce hypoglycemia and we measure the level of growth hormone. If growth hormone doesn't increase after insulin induced hypoglycemia, this is a reliable evidence of growth hormone deficiency. ممكن أيضا I measure the insulin growth factor 1, which is mediator of the action of the growth hormone, and it is released by the liver. If it is low, it give an idea about the level of the growth hormone, that because it is stimulated by growth hormone. So if there is no growth hormone, it means that the level of insulin like growth factor 1 will be low. It is not very sensitive, must be interpreted in combination with other tests. Why? Because it depends on many other states, for example the nutritional state, the age of the patient, and other. الانسولين growth factor binding protein 3 هو another protein ممكن يكون مفيد. Maybe a marker of growth hormone deficiency in children. Normally this protein bound to insulin growth factor 1. In case of a growth hormone excess, in this condition we need certain suppression test. بهالحالة حيكون الهايبرغلايسيميا. We give the patient a defined dose of glucose, and then after a period of time we measure the level of growth hormone. If the level normally must decrease after the hyperglycemia. If the level doesn't increase, then it means that the secretion of growth hormone is autonomous and is not subjected to the negative feedback control. If the patient came with a suspected ACTH hormone deficiency, then in this case we can perform many tests. We will talk in details in the adrenal lecture, but generally one of the tests is the insulin induced hypoglycemic test. And in addition to many tests, for example, if I have a low level of cortisol, I can stimulate the adrenal cortex by a short ACTH stimulation test by giving a patient a synthetic ACTH analog, which is similar to the ACTH. Normally, the level of, after giving a synthetic ACTH, the level of cortisol must increase. Failure to achieve this response will confirm that level of the level of cortisol. If failure to increase, it is a sign that a patient have adrenal failure and it cannot synthesize the cortisol. From the posterior pituitary hormone, we have two hormones. We have the vasopressin, and the other name is called the antidiuretic hormone. It is very essential for life. And we have oxytocin. Although these hormones are released from the posterior pituitary gland, but they are not synthesized there. Instead, they are synthesized in the hypothalamus and passed down through the nerve axon to be released from the posterior pituitary gland. Oxytocin is involved in the control of the uterine contraction and ejection of milk from the lactating breast. Vasopressin, or what is called the antidiuretic hormone, it acts as a regulator of renal free water excretion, so it is very important in the control of water balance, on the tonicity of the extracellular fluid, and indirectly it will affect the intracellular fluid. Vasopressin receptors are found in the kidney. They are concentrated mainly in the renal collecting tubule and in the loop of Henle, mainly in the ascending limb. The major stimulus to vasopressin release is when we have increase in the plasma osmolality. In this condition, we have the hypothalamic osmoreceptor that will be stimulated by even a small change in the plasma osmolality. When the osmolality increase, vasopressin secretion will increase, and this will result in reduction in the renal free water clearance. This will end up in lowering of the plasma osmolality and return to the homeostasis. The other stimulus for the vasopressin release is a decrease in the extracellular fluid volume and in the blood pressure. This will be sensed by the vascular baroreceptor that are located mainly in the left atrium, in the aortic arch, and in the carotid artery. When they are sensed in case of decrease in the blood pressure and the extracellular fluid volume, as in case of bleeding, in this condition it will initiate vasopressin release, and the water excretion will decrease, and later on the normal homeostasis will be achieved. Abnormality in the excretion of vasopressin: either we have abnormal increase in the vasopressin secretion, and this will lead to delusional hyponatremia, in which there is a decrease in the water excretion from the body, and result in delusional hyponatremia because the sodium will be distributed over a large volume of the fluid, and may lead to also water intoxication. The other abnormality, when we have abnormal decrease in the secretion of vasopressin, as a condition called diabetes insipidus, could be due to decrease in the secretion from the hypothalamus. We call it cranial diabetes insipidus, and the patient will be presented by polyuria and polydipsia and may lead to severe dehydration. And sometimes the abnormality is on the level of the kidney. We call it nephrogenic diabetes insipidus. The summary of this lecture is that the anterior pituitary gland will secrete many hormones, growth hormone and prolactin that act directly, and we have the trophic hormone that control the activity of other glands, which are the LH, FSH, TSH and ACTH. The secretion of these hormone from the pituitary are controlled by the hypothalamic hormone, and the hypothalamic hormone reach to the pituitary by the portal system of blood vessel. Then they will induce the secretion of trophic hormone. The trophic hormone will exert feedback mechanism, control the secretion of the pituitary hormone. The posterior pituitary hormone are the oxytocin and vasopressin. They are synthesized in the hypothalamus and reach the posterior pituitary through the nervous axon and released from there. The vasopressin is very essential to life because it controls water excretion. Excessive vasopressin produce water retention and delusional hyponatremia, and defect or decreased vasopressin secretion result in diabetes insipidus with polyuria and uncontrolled renal loss, and in addition to polydipsia and dehydration. Thank you, and ready for any question.